This is a community conversation, a listening session of the residents of the town of Ossining.
Thank you so much. Good morning, everyone. On behalf of Westchester Medical Center Health Network, I'm pleased to be here today helping to support this phenomenal event because it informs our decision-making back in our health system. It allows us to offer patient-centered care. It allows us to be better, stronger, more efficient, and more importantly, more responsive to those diverse communities that we serve throughout the Hudson Valley.
And I am Carola Bracco. I'm the Executive Director of Neighbors Link. We offer services that help integrate the whole community. There are different areas called the social determinants of health, which indicate the importance of healthcare that happens outside the hospital and outside your doctor's office. And these include issues such as housing, education, child care, all these kinds of issues that reflect very much on people's health and well-being.
So to be able to identify what our priorities are here in our community and be able to partner with organizations like United Way to make those needs known at the state level, the federal level, couldn't be more timely. So
one of the issues that I run into, I'm an occupational health nurse, one of the issues that we run into is the underserved at-risk population in the workforce, mostly immigrants, mostly English as a second language, if that. When they get hurt on the job, they're afraid to go for health care. There really is no place for them to go for health care. DOH has funded clinics across the state for occupational medicine, but the clinics have been flat funded now for the past 5 or 6 years. And as we get more immigrants into the state, more of them working in non-union jobs, more of them working in low-paid, high-risk jobs, the more opportunity it is for them to get hurt and then have nowhere to go. So we just don't have the resources to get out there and let everybody know we have these clinics available where they are. Even getting the emergency rooms to understand that you get hurt on the job, it's a workers' comp issue, not to ask for the private insurance. But a lot of people think your private insurance is the path of least resistance, and they end up paying for it. If it's an ongoing issue that originated out of the workforce, workers' comp should be paying for it. And that's where we need to increase the DOH funding for these clinics, because we're able to treat these at-risk folks that don't have the workers' comp coverage. Some of the workers that are working for private companies don't realize that they are covered by workers' comp, but because they're illegal, they don't want to go anywhere. They don't want to say anything. They'll go to their. There's a community within a community. So the Polish workers, the Ecuadorians, they'll go to their own community. And we've got to get into those communities and let them know that we're a safe place. We're not going to call INS, we're not going to call immigration.
Everything contributes to our health, our physical health, certainly our mental health. Now, I think the point about health and being part and parcel of mental health is like key, critical.
The elephant in the room is the liability piece. If I interview a person and they say, yeah, I wanted to kill myself, but I feel better now, and we check the form and we're good, and I leave, and then that person blows their brains out, where am I now? And where is my department, my village? As soon as we would get wind that the person was contemplating suicide, that's it, they're going, period. And many times we'd be able to talk them into it, sometimes we wouldn't, but we went from taking 2/3 of the people to now taking 100%. And that impacts the hospital, the facility, the hospital. While we talk about guns and security and things like that, in my opinion, with my experience, we need to really start talking about mental health and doing a better job of dealing with these issues ahead.
We want somebody to be like the crisis team, with more training than is have, to come in and do the evaluation of the spot. Because you want that crisis intervention reinstated.
Yes.
And it's even broader than that. It's in the schools, it's noting when people are becoming remote, sulking, depressed, are putting strange things out on social media.
And they do a lot in terms of paratransit and stuff to help them get to medical centers and other places.
And they did try paratransit. Sometimes in dental they faced things like you have to make an appointment weeks in advance to reserve, and you have to have a 2-hour window before and after kind of the appointment. And if you're talking about someone who has significant health issues, a 2-hour window on either side, I mean, that's a long time for a person to be out and about, so to speak.
As far as Westchester goes, it's interesting because I also meet with Putnam County. Putnam County, they're like, I'll come in and I'll talk about our services.
So the issue is that to access those services, it's a long wait. And you have to plan ahead, which can be a challenge for many of us as parents.
Hours of operations of different agencies and different health providers could be. So I am going to ask Celsa the same thing about how are the hours of operations when she wants to take care of her health. So, Doña Celsa, cuando usted va a sus citas dentales o a su cita en Open Door con su médico, las horas de operación son convenientes para usted y su familia.
Therapy for trauma, childhood trauma, any kind of crime-related trauma. So I've actually had a lot of clients who are from Ossining who even just going to Elmsford, which is the closest office to them, was too far for them. Or just traveling there, which is going to take up too much time, and then they had to go to work. So I've seen that when the focus is on trauma, there isn't a lot of services for them here in Ossining. Yes, they have the Open Door, and yes, they can receive mental health services, but therapists who specialize in trauma, we don't have that anywhere up here. I mean, we do have WJCS, which is located in Peekskill, but even for parents who don't have the money or they don't have the car to drive up there, it's transportation, it's too far.
I think at one point, the church also played a role of, having someone that you could at least talk to. Absolutely. Do you think that is still there or not?
I'll speak on it's for Hispanic and Latino families. They still have that support system from their pastor, the minister, the priest. However, they're not really recognizing that the priest can't really, I don't know, but the priest can't really help them in regards to their childhood trauma. There are, or there is domestic violence, let's say, in the home. The specialization is what's missing, and that's what a lot of families are not understanding.
Do you think, though, that in that situation, that if you train ministers or that they would say at some point that you need to go see someone and here is someone?
Perhaps.
Some are getting trained, some are getting masters. And they do that. They also refer business where we have Open Door, school social workers.
I think that comes back to, do we have the specialized services in the locations where they're needed, not necessarily being said, now you have to take 2 buses and walk down the street around the corner to get to where you need to be when you have to take 2 jobs and get back to your kids. So it's like, how do you put all that together for individuals? And are they in a county that's so large, are they evenly distributed throughout the county? Or do you have to live in Yonkers, White Plains, and Peekskill to access your services?
Teenagers, and they're in need typically of some subsexual reproductive health, and they're not turning to their parents. They don't have a call the doctor, or make an appointment, have a toothache. They're now kind of on their own at a tender age, where it can become it's clearly very uncomfortable to talk about these things. And their introduction into the health system at that age, I think, is critical. So, as a provider myself, I feel like that my impact at that moment can really have a long-lasting effect on them.
What you're identifying is a difficulty within the system in connecting him with the help that he needs. And there may be whether there's a lack of funding for dealing with someone with his particular issues, or if there's a lack of communication between agencies on who or where he should be taken, that's a difficult, that's a
Yeah, I know
family-
you guys,
that's
you
a
do
fa-
a good
but that-
job, but
that's a-
the thing I said,
that's a
after
fa-
that, it should be something.
That's a family problem that is so deep and difficult to deal with. And something like they, for the health of the two girls in the home, I would hope that the mom eventually would keep him out of the home.
She tried. She said, "I don't have a place. Please don't bring him back." But since they want to put him in the street, he's mental. I think
Communication about the services that are out there is critical. What we found at our table of mostly providers was that by and large, they didn't know about one another's services. The services are fragmented. You're having to go from pillar to post to necessarily get what you need. And lastly, coordination among the services. Communication and coordination was critical. And that's where everybody was saying it in a range of different ways. But people were not, if you were the target population, you were not necessarily aware of what was out there, where it was offered, how to get it, or how to coordinate the services.
And in many cases, the services were not well located in Westchester County and in Putnam, so that they may be provided somewhere, but if you're up in northern Westchester and you need to go down to Yonkers, transportation is a major issue. It may take you a long time, and you may just not go as a result of that. So,
For men's health, the first place both groups started was men don't go get treatment. You're laughing. Men don't go get treatment unless it hurts, and hurts a lot. Start educating the younger population, preferably in schools, so the coaches work with the kids who are on the teams. Eat well, get your rest, do all the things to help you excel and win games. But what about everybody else?
A lot of it was cultural, as we were saying with men's health, that men don't want to go to the doctors. They don't do their immunizations. They don't do a lot of the things. They want to tough it out. So I think a lot of focus was being put on, we need to get some changes going on there, that they understand that it's okay, and that may also relate to issues of mental health. I think in all the things that we talked about, mental health was a big area that was not really addressed well. I think in fact, it was not one of the topics that was pulled out, but I think in every group that we've had, mental health came up as an issue. And that it is an area that is very, very tough, and that there are not sufficient resources around to address this.
We found that the providers, they didn't know much about what one another were offering, and they were all feeling a bit adrift to nearly adequately address the issues. With violence and trauma, it was the availability of services. So if it's a safe house, a Hope store, wherever, there aren't enough facilities around for the women who necessarily need them. They're very widely dispersed and across the state, and in some cases, for the woman to go get shelter, she has to leave her own community, so she becomes doubly disconnected from family, which makes it all the more difficult to leave home. Man or another man who's being abused, they often get put in homeless shelters because the women's shelters don't necessarily have the staffing to deal with putting a man into a woman's shelter, and they get afraid of how they're going to handle that. So services, location, availability, transportation. Very hard, especially if you're in a community where the population is working 2 and 3 jobs. They don't have time to travel half a day back and forth and for the service.
I think one thing about men's health and it leads over to violence and trauma is educating young men on masculinity and different forms of masculinity, and there's a need for preventative services for young men that focuses on not stereotypical forms of masculinity.
We were the women's health and taking charge of your health, but the majority of our conversation was really dominated by health insurance companies. and how they seem to drive the health of people in general. And time after time in both sessions, we heard stories of women going for testing. They were assured it would be paid for, and then they ended up receiving the bills, right? So there's a disconnect between what the doctors and the practitioners think is covered, and the offices tell us is covered, and what is actually covered. And it really becomes almost a full-time job of advocating to get your money back, and that in fact in many parts of the population, they see that as a barrier to going for health care in general. One woman shared that even though she has health insurance, she's afraid to use it because every time she goes to use it, it always incurs extra charges constantly. We did hear that a local clinic, our local Open Door seems to be providing a good complement of services. We heard that in both sessions. But for people that are, but there can still be long waits, particularly in the area of dental. It can be a long wait, but we pointed out that dentists in general, you know, if you're a mom and you're trying to access that for your kids, it can take months and months to get an appointment. Health insurance really dominated our conversations because I think being a woman and and going to the doctor, you often get these enormous bills, right? For mammograms or sonograms or tests that you didn't ask for, and you end up being the person in the family that's calling up and contesting all these charges. In terms of health priorities, you know, what are the health issues that we felt were sort of at the top of people's radar? Diabetes, substance abuse, mental health, and depression, and the need for support networks for women. But I think everyone needs support networks. But mental health did come up a lot as well, and in fact, it really should be a topic at the table, because without mental health, you don't have health.
So in the first group, we spent some time talking about resources for LGBTQ community. Actually, Westchester County, I learned, is completely devoid of any kind of community resources for the LGBTQ community, which is very startling. So that, you know, if legislation or policy can address really how to provide more community-based services, I think is what we were saying, for that community, that's a very well-needed area. And in the second group, I'll just piggyback right on that now. In the second group, we were saying really that the focus needs to be in the schools, that there aren't really any programs. GSA clubs no longer really exist, or if they do, they're not well utilized, that there's an issue for them to be culturally competent, and that often that's a deterrent for kids accessing GSA programs in the schools. GSA being Gay Straight Alliance, which was always a thing, you know, when I was growing up and, you know, my years working, and now I'm hearing that it's not so much, it's not really in the schools as much anymore. We also said that mental health is, as Alice said, mental health is health. So, and we were really kind of addressing the needs in the schools, that we're seeing children as young as preschool ages showing mental health issues. So this is something that really needs to be focused on in the schools, providing more school-based mental health programs. In the second group, we kind of were having a lively conversation about food and nutrition. We would like to see more policy or more of a focus on affordability in particular, and access to good, healthy food.
So for aging, the general question that went around the table is, as a community, how can we recognize if an elderly person is in need? So assuming they don't have a caregiver, a child or a relative nearby, are there ways we can educate the community so that we can have the folks that go in and give them meals through the Meals on Wheels program, or other volunteers notice if this elderly person has another crisis going on in their life because they have no caretakers? So we got into a lot of conversation around educating volunteers to do quick assessments and then raise it to another level. So we need to educate children, neighbors, caregivers, volunteers, to look for signs and escalate things to another level if you think an elderly person is in distress. He gets a lot of, or the police department gets many phone calls, and I'm sure in all of our communities, for elderly folks who have fallen. Obviously that becomes, in some cases, if they're in dire straits, it goes to an emergency room, and then they may get assessed at the hospital if, again, if they don't have a caretaker. The other way to educate folks is through the senior centers, the community centers, and just, again, educating our friends, neighbors to just be attentive to the needs of elderly folks who might be in distress. Oh, and one, on a fun topic, we were told by someone in the first group that there's something called a Silver Sneakers program where senior citizens can go to their local health clubs and perhaps get a free membership to keep them healthy. Then we went on to the subject of people with disabilities. With regard to disabilities, there were several experts around the table in the first session, and we noticed that if you notice that a child has a disability like autism, you may be able to pull that child out of the regular school system and get them some special medical coverage so that it doesn't become a burden on the family. So that was the first topic. So there was something called the Medicaid waiver that you can apply for that might take a year, but it could cover that child who's perhaps not going to, who perhaps will have a disability throughout their lives. There are also one-stop centers up in, I think it was the area of Monroe, and I think they may be all over the several counties locally. There's a medical building that houses all of your services. So if you're disabled and you're in a wheelchair and you need special transportation to the doctor, you don't have to go from building to building. It's all in one place. Transportation, as Naomi said, is always an issue for people with disabilities and people who are elderly. Jim, who's on the police force here, mentioned that there are phone numbers that you can call for caller rides, for sharing transportation. That's obviously an issue for most of these folks. For kids with disabilities, there are special trainings for parents called SEPTA, Special Ed PTA, and there are convenings like we're doing here where you get experts in the room to teach parents how to handle kids with emotional and disabilities and things like autism.
When we had the discussion about nursing homes, it was pointed out that culturally, the Spanish-speaking population does not understand the concept of nursing homes. So that maybe there's a way that we can address that and help everyone understand about nursing homes and what it takes to get into it, what they do, what they don't do.
I just want to share with you that I create a group in Facebook. It's called Ossining Padres Hispanos, and if you have any information for my group, it's welcome. You can put any information there. We really need your suggestions. We really need any programs going on in the community. You're welcome to the group. The group is created just to help the community with the announcements, anything going on around in the community.